Death toll in China rises to 564 as lockdown enters third week. The death toll and number of infections continue to soar in China, officials said Thursday. It has been 2 weeks since the authorities in Wuhan, the center of the coronavirus outbreak, declared that the city would be locked down as they tried to contain the virus's spread. The cordon that was first imposed around the city of 11 million quickly expanded to encircle roughly 50 million people in the province of Hubei. The lockdown is unprecedented in scale and experts have questioned its effectiveness. Wuhan and Hubei Province have borne the brunt of the epidemic as the sudden shutdown of transportation links into and around the area slowed the shipping of vital medical supplies. The fatality rate in Wuhan is 4.1% and 2.8% in Hubei, compared to 0.17% elsewhere in mainland China. The Chinese government says the quarantine has prevented a broader outbreak, but its effects on residents of the lockdown zone have raised ethical concerns. This is almost a humanitarian disaster for the central Chinese region, said Willie Lam, an adjunct professor at the Center for China Studies at the Chinese University of Hong Kong, who cited insufficient supplies of medical equipment, food and other necessities. The Wuhan people seem to be left high and dry by themselves. The World Health Organization said on Thursday that 564 people had died in China from the virus, up from nearly 500 people the day before, and that 28,060 cases had been confirmed in the country. There are also 225 cases outside the country, and 1 death. Many doctors believe that deaths and infections are undercounted because hospitals and laboratories are under severe strain to test for the virus. Local officials in Hubei Province, the center of the outbreak, have called on health care workers to speed up the process. Many sick residents in Hubei also say that they have been turned away by overstretched hospitals, which lack test kits and beds. A senior Chinese official has ordered the authorities in the city of Wuhan to immediately round up all residents who have been infected with the coronavirus and place them in isolation, quarantine or designated hospitals. Sun Chunlin, a vice premier tasked with leading the central government's response to the outbreak, said city investigators should go to each home to check the temperatures of every resident and interview infected patients' close contacts. Set up a 24-hour duty system. During these wartime conditions, there must be no deserters, or they will be nailed to the pillar of historical shame forever, Ms. Sun said. The city's authorities have raced to meet these instructions by setting up makeshift mass quarantine shelters this week. But concerns are growing about whether the centers, which will house thousands of people in large spaces, will be able to provide even basic care to patients and protect against the risk of further infection. A lockdown across the city and much of its surrounding province has exacerbated a shortage of medical supplies, testing kits and hospital beds. Many residents, unwell and desperate for care, have been forced to go from hospital to hospital on foot, only to be turned away without being tested for the virus, let alone treated.